In this video, we will discuss about this pancreatic cancer glycosylations overview and some of the strategies that can be used to treat or diagnose these pancreatic cancers. So, and we will discuss based this pancreatic cancer diagnosis based on the glycosylation or the changes in the glycosylation. First, we will discuss what are the changes that occurs or has been observed in the pancreatic cancers. So, one of the major changes in the glycosylation occurs with these truncated O glycans that can be seen here. We can see some of the examples that are shown here, and other categories of the changes that occurs in the glycosylation is highly branched N glycan. Usually in the mammalian cells we observed complex N glycans, but here in the pancreatic cancer stage, in pancreatic cancer patients, doctors and researchers has observed highly branched N glycans, and also they have seen the increased silations and this core and outer arm fucosylations. Usually the fucosylations is at the uh, starting of this carbohydrate structures, but researchers have seen at this outer arm fucosylations also. And all these changes in the glycosylation helps the pancreatic cancer cells to evade from the immune system, and in other way it will also helps in the tumor progressions. So how these things can be used or targeted to prevent the progression of the pancreatic cancer cells. One of the approach is that is mentioned in this paper is to use this aziluricon, which is known to compete with this RAGE ligand, that is for example this S100 and HMGB1, and these ligands in the pancreatic cancer cells helps the cells towards invasion metastasis. So if we use this aziluricon, which can compete with this RAGE ligands, that is receptors that interacts with these ligands, in full form of this RAGE is receptors for advanced glycosylation end products. So if these ligands binds to those receptors, that will help in the invasion metastasis and the chemoresistance. So if this, instead of this HMGB1 and S100, if this aziluricon binds, then we can suppress the invasion metastasis, and the chemoresistance towards drugs such as 5-FU and gemcitabine will also be reduced, and or we can say that it will increase the efficiencies of the treatment of this 5-FU and gemcitabines kind of drugs. The other strategies that or the other medicines that can be used is to use mineralide. Mineralide, what it does is this mineralide is presently in the inactive form, and through this esterases which is present in the liver, it will cleaves this mineralide and it will make into its active form, that is triprolide. This triprolide can prevent the XBP interactions with the super enhancers, and thereby the CMYC's formations will go down, and it will prevent the tumor proliferations. And the other approach, which is the most common approach nowadays, is this leukophoresis. In this case, T cells from the patients can be taken out, or the healthy donor T cells can be used. But the disadvantage in the healthy donor T cells is that it will have a less half-life time period with whereas if the T cells are used from the patient, it will have a high half-life periods. Or currently, if the T cells from the same patient is used, then they only need one time infusions. So once the T cells has been taken out from the patients, then it will genetically modify to target KRAS G12 mutations, and those T cells can be again infused into the patients, and then it will directly target this tumor proliferations and the immune invasions. Or what it will does is it will enhance the immune system of the patients to proactively detect the tumor cells, thereby suppressing these immune invasions, and also will leads to the suppression of the immune tumor proliferations. So these are some of the strategies that are mentioned in the paper. If you need to understand more about this pancreatic cancer cells diagnosis using the glycosylations in detail, you can go through the reference that has been provided in the description. That's all for this video. Thank you for your time.